Most men have no idea how often prostate cancer is missed until it is too late. The reality is that many early symptoms look completely normal. Men often assume these changes are just signs of aging, stress, or minor urinary issues. However, ignoring these early warning signs is exactly why prostate cancer remains one of the most commonly diagnosed cancers in men worldwide. Today, we are going to look at 13 early warning signs you should never overlook. These symptoms can appear weeks, months, or sometimes years before the disease becomes severe. I am Dr. Ava, and I want you to stay with me until the end. By the final symptom, you will be able to say with confidence whether you are safe or if you need to schedule a screening. The last symptom is something 99% of people ignore, yet it is often the reason many cases are detected late. It is important to remember that many of these signs can also appear in other health conditions. That is why understanding the combination of symptoms is crucial. Let us get started with the first sign. 1. Frequent nighttime urination, also known as nocturia, is one of the earliest and most overlooked warning signs of prostate cancer. Waking up multiple times at night to urinate may seem harmless. However, it often indicates that something is interfering with the normal flow of urine. As the prostate develops a tumor, it can press against the urethra, which is the tube that carries urine out of the body. This makes it harder for the bladder to empty. Many men blame aging or drinking water late. However, prostate-related nocturia has a specific pattern. The urge feels sudden and urgent. It is often accompanied by a weak stream. Even if the feeling comes and goes, repeated nighttime trips are a signal that your bladder is under constant pressure. 2. A weak or interrupted urine flow is another important warning sign. You might notice the stream has reduced force. It may start strong and then suddenly slow down. This happens because changes in the prostate narrow the passage. You might only notice this in the morning and forget about it during the day. That inconsistency is exactly why it is easy to overlook. A weak flow means the bladder is struggling to push past a restricted area. This often leaves the bladder partially full. 3. Painful ejaculation is a symptom many men find difficult to discuss. However, it is a critical indicator of prostate health. The prostate produces the fluid that helps move semen through the reproductive tract. When inflammation or abnormal tissue growth occurs, it interferes with the nerves and muscles involved in this process. You might feel a sharp pain or deep pelvic pressure during or after ejaculation. If this sensation repeats, it is a sign that the prostate structure is no longer functioning smoothly. 4. Blood in the urine or semen is a serious warning sign. The prostate sits very close to tiny, fragile blood vessels. A growing tumor can place pressure on these tissues. This can cause the vessels to rupture. In the early stages, you might only see a pink, brown, or rusty tint. Even if it only happens once, blood from the prostate does not appear without a reason. Identifying this early is critical for effective treatment outcomes. 5. Persistent pelvic discomfort is often dismissed as muscle strain or digestive issues. However, as abnormal cells grow in the prostate, they can press against nearby nerves and tissues. This creates a dull, aching heaviness deep in the pelvis. This discomfort does not go away with rest. 6. If you feel constant tightness while sitting or discomfort that worsens during activity, your body is signaling that something is not right. Incomplete emptying of the bladder is another warning sign. You may feel like you still need to go even after you have finished urinating. This sensation of trapped urine occurs because the prostate is narrowing the urethra. This lingering pressure often forces men to return to the bathroom just minutes after leaving. This constant residual urine increases the risk of infections. It can eventually weaken the bladder wall. Before we continue, if you have found this helpful so far, consider liking the video. Subscribe to the channel and share it with someone who may be ignoring early urinary or reproductive health changes. True health mastery involves listening to the subtle whispers of your body before they become screams. If you are serious about proactive prevention, the next symptoms are vital to your understanding of this silent disease. 7. New difficulties with erections can be another early sign. Erectile function depends on healthy nerves and blood flow. Because the prostate sits close to the nerves that control erections, abnormal growth can interfere with these pathways. You might notice that erections are weaker. They may take longer to develop. They may not last as long. While many dismiss this as stress or age, it can signal nerve interference in the pelvic region. 8. Painful or burning urination, also known as dysuria, is another warning sign. Many assume this is just a minor infection. However, it can also indicate prostate inflammation or growth. As the prostate affects the lining of the urinary tract, it creates a stinging sensation. If this discomfort persists or occurs every time you urinate, the pathway may be compressed or damaged. 9. Chronic lower back or hip pain can be a serious sign. It may indicate that cancer is affecting nearby bones or nerves. When cancer spreads, it often causes persistent pain that does not improve with rest. This is different from a simple muscle strain. It is a deep ache that often worsens at night. 10. Difficulty starting or stopping urine flow is another warning sign. Trouble beginning to urinate is often called hesitancy. This happens when the prostate presses against the urethra strongly enough to create a blockage. You might feel the urge to go but need extra time before the flow begins. You may also find it difficult to stop the flow once you are finished. This repeated straining puts stress on the bladder and kidneys. 11. Sudden and uncontrollable urges to urinate can also occur. This happens when cancer irritates the nerves controlling the bladder. The bladder may contract suddenly even when it is not full. While people often blame caffeine or anxiety, this type of urgency feels harder to control. It also occurs more frequently over time. 12. Unexplained weight loss is a major warning sign. Cancer cells demand constant fuel. They pull energy from fat and muscle stores. If your clothes are fitting looser without changes to diet or exercise, your body may be under internal stress. This can indicate that your metabolism is being affected. 13. Persistent fatigue or weakness is the final and most ignored symptom. This is not normal tiredness after a long day. It is a deep exhaustion that does not improve with sleep. Cancer cells consume energy rapidly. This leaves you struggling with simple daily tasks. Taking action today can make all the difference. If you have noticed any of these symptoms, especially in combination, do not ignore them. Prostate cancer often remains silent until it becomes serious. Early detection through a PSA blood test or a physical exam can save your life. Your health is your most valuable asset. If something does not feel right, speak to a healthcare professional immediately. Share this information with the men in your life. They may be ignoring these silent warning signs. Please like the video, share your thoughts, and subscribe to the channel. Take care of yourself. Listen to your body. I will see you in the next video.